I want to talk about two things really. I want to talk about the connection between the cuts to mental health services and the NHS in general and the welfare reforms. And I also want to talk about our experiences in Equal Lives of dealing with this, and also experiences that I've had personally in relation to family members. As you see from the case studies around the walls, these are life and death questions. People are dying, people are committing suicide as a result of the welfare cuts, of the changes to benefits. And the situation is so serious that the United Nations have launched an inquiry into the situation in the UK. It's a high-level inquiry. It's going on in secret, but it's investigating the grave and or systematic violations of the rights of disabled people in the UK. And this is based on evidence that we've provided through Disabled People Against the Cuts and through Equal Lives and other disabled people's organisations around the country. And it's done under the optional protocol of the UN Convention on the rights of persons with disabilities. And that shows just how serious this situation is. I don't think we can underestimate. We're in it, we're living it every day. But the outside world is looking on incredulously because it can't understand how Britain has gone from having some of the best mental health services, some of the best provision for disabled people globally. We were the leaders in terms of the disability movement internationally, of cross-impairment work, working across all the impairments, saying actually this is about people who face disabling barriers across the board. It doesn't matter what their impairment is. And we've got to a situation now where life has become cheap. And government ministers and civil servants and bureaucrats are disregarding human rights as a matter of course. They're massaging figures, they're lying, and it's a daily occurrence, and it's delusional. And if there were services and the eligibility bar wasn't so high, many of them, I suspect, would end up in the service just because of their complete delusion. Locally at Equal Lives, we run information, advice and advocacy services. And we're shocked. We've been doing this for a long time, and we're shocked at the sort of stuff that's coming through daily to us from people phoning in and saying, I need a service, I can't get it. I've got a mental health condition, they're threatening to take my children away. I'm in a crisis, I can't get a crisis team. It's awful across the county, in the west, it's impossible to find it. There's no prevention in community-based services. There's lack of beds. Not only are people being sent all over the country, you know, Doncaster, Darlington, London, all to private hospitals, or in generally to private hospitals, costing a fortune. Ripping people away at a point of crisis where they need their family and their networks around them, and they need their community. With the closure of the suites, we were outside Carlton Coldville Hospital the other week, and with the closure of those suites, when people are in crisis, their local GP is supposed to be the intelligence, they're supposed to provide the information because they know the person. And how can they do that if that's not there? How, if you're stuck in a hospital in Darlington, how can that understanding be there? It can't be there. It's cruel, it's inhumane. An increasing number of our cases of people coming to us are disabled parents, often with multiple impairments, including a mental health condition. And, you know, at a point of crisis in a family, when you need things put around you, actually, because those things aren't around there, it splits families up, and it costs the state a fortune, and it damages lives for this generation and the next generation and the generation after that. These aren't small questions, these are real people's lives. We understand it. It's not that there's ignorance and that we don't know this. We know it, and it's a deliberate attack on public services, on state services, on the professions, on services that people need. And that's why those posters are up around the wall, because these are life and death questions. Mark Wood, who was 44, had a whole number of complex mental health conditions. He died in his home in August 2013, months after Atos Fitness for Work assessment found him fit for work. This assessment that he was fit for work triggered an assessment by the job centre to stop his sickness benefits, and that left him £40 a week to live on. As a result of that decision, his housing benefits were stopped. The Oxfordshire coroner said that although it was impossible to identify the cause of death, it was probably caused or contributed to by Wood being markedly underweight and malnourished. He weighed 5 stone 8 pounds when he died. His doctor said his body mass index was not compatible with life.
He died of a broken heart.
He died of starvation and a broken heart. That Mark lived in Cameron's constituency in Oxfordshire. Unfortunately, this isn't an isolated example, and I could give you dozens and dozens of examples. The Department of Work and Pensions at the moment has carried out 60 secret reviews into benefit-related deaths since February 2012, and they won't publish them. The Scottish-based user-led campaign group Black Triangle has collected 40 examples of people, most of them disabled people, who appear to have died as a result of being found fit for work through the work capability assessments, having their entitlements to benefits subsequently refused or removed. Many of the cases have come to light through media reports, but in the case of MSDE, the Mental Welfare Commission for Scotland concluded that the work capability assessment process and the subsequent denial of employment support allowance was at least a major factor in her decision to take her own life. And the BBC You and Yours programme this last week spoke to the sister of Tim Slater in Staffordshire, who killed himself after he was found fit for work by Atos. The Atos assessment failed to take into account his mental health condition and only examined the impact of his sight impairment. His case is now being reviewed by the DWP. A coroner concluded that a major factor in his death had been that his benefits had been greatly reduced, leaving him almost destitute and with a threatened repossession of his home. So these aren't small questions. That's why when Norman Lamb behaves like an activist, lectures us on how awful things are, how unacceptable things are, we need... My attitude to it is, he either needs to put his money where his mouth is. When he talks about parity for mental health, he needs to put his money where his mouth is, or shut up. He needs to stop behaving like an activist and take responsibility. He's the Minister of State. He's responsible, and his government is responsible. What's clear is... Go on.
So Duncan Smith. That man needs to put in a straitjacket. A straitjacket.
Ian Duncan, we hounded Ian Duncan Smith last week in Ipswich.
He's a psychopath! A man's a psychopath and a narcissistic psychopath.
Mick and I spent the day in Ipswich last week hounding Ian Duncan Smith with the DPAC banner.
Hurting people. He likes hurting vulnerable people that can't fight back.
I don't think he's a member of the human race.
No, he's not. He's not. No, Ian Duncan Smith is a bad man.
But my point is,
Sorry. I have to
because I don't think we should.
That's my.
Yeah. No, I could go on all night. Believe me.
Sorry.
But I think that's a diversion, because I don't think we should pathologise Ian Duncan Smith or Norman Lamb or anything. They're part of a government that has imposed the crisis of the banking system onto poor and disabled people. And we're being made to pay for their ills, the break in their system. And it's a deliberate political strategy. Austerity is presented as Margaret Thatcher would have said, there is no alternative. Tina. It's a deliberate policy to drive people's living standards down, withdraw the state, cut public services and open them up to privatisation. Let's be very clear about that. But austerity isn't a policy of the Conservative government and the Lib Dems. There's a political consensus in this country amongst our political class for austerity. So this campaign is a year old. We'll be back here this time next year with a new government, and whoever is elected, we will have austerity, because the Labour Party and the Labour leadership is signed up for at least 2 years of austerity beyond the election.
Shame on them. Absolute shame.
So what I'm saying is, as other people have already said, this fight isn't going to go away. We need to step it up. I think the occupation in Cambridge shows the way and is very powerful.
So it's really sad, is it not, that patients have to occupy an NHS building. Patients have to do it. That is really hitting the bottom of the barrel, in my book. Absolutely.
Absolutely, but that's the only way. And I think what's really powerful about this campaign is that it isn't just patients, it isn't just service users.
No,
it's patients,
and it's family.
Yes. It's professionals on the platform,
It's
in
the
the
public.
audience,
Yes.
who are coming here and making a statement that
Exactly.
enough is enough.
That's right.
And we need to build on that and transform that.
Here.
It is all of you.
Finally, what I'd just like to say is that we need your evidence that this UN inquiry is ongoing, and it's about the human rights abuses that are going on. It's about the disproportionate impact of austerity and cuts on people who face disabling barriers. So if you've got examples of where people are being discriminated against, where it's disproportionate, we need it. And what I promise you is, if you give me the evidence, I will make sure it gets to the people who are carrying out the inquiry. Thank you very much.